Facebook is partnering with mental health organizations on a new tool to help prevent suicide. Here's how it works. If a friend posts something troubling on Facebook, you can report it. Facebook then reviews that post, and then they offer options for the person in distress. That person can connect with a mental health expert, they can reach out to a friend, or they can look at tips that might help them work through their feelings. Ursula Whiteside is a research scientist at Forefront. That's one of the mental health groups that's working with Facebook to develop this. She's here to tell us more. Ursula, thanks very much for being here.
Hi, Sarah. It's good to be here.
Now, this is obviously a really important tool, and Facebook already had kind of an existing suicide prevention tool. You guys worked to make it better. What did you think needed to be fixed? What had to be improved?
That's right. Yeah. Well, just a little context here as well that, 2013, there were 41,000 suicides in the United States, and most of us aren't really aware of that. That's equivalent to the number of breast cancer deaths in the United States, but you see a lot of people in pink. You don't see a lot of people in, for example, red, concerned about suicide. And Facebook has approximately 82% of the United States population are on Facebook, and that means that the potential impact here is enormous. And so what Facebook wanted to do was to include people who had been through the experience of being suicidal in improving their tool and making it even more useful than it already was. So those people with what's called lived experience were included at every step along the way. People who had been suicidal or who had made suicide attempts were consulted, help develop the product and help improve it as we went along.
Now, in addition to all the support options you guys offer for people who are in distress, you also included a tool that supports the friend who raises the red flag in the first place. Why is that so important to you?
That's a great question. And also, taking a step back, if you're a friend who's concerned and you go to Facebook to say, what should I do? I'd like Facebook to look at this. Facebook will first say to the friend, actually, it would be more helpful if you reached out to the friend, or if you did some of these other things before, having us take a look at it, because it's that direct contact that's going to have the most impact. And so the tool itself, if you do decide to go ahead and ask Facebook to take a look at the post, then Facebook will look at it. If it looks like it is suicidal content, they'll offer resources. But what it gives the person who is the concerned friend it is some tips, like how to go about communicating with your friend in a way that is going to be most useful for them. Because a lot of people don't know what to do when somebody's having a lot of emotion or distress, and that's actually the time when it's absolutely most critical that you know what to do.
Now, Ursula, I'm curious about this from a personal perspective, because you have gone through this. You have had these suicidal thoughts yourself. And I feel like there are going to be a lot of people who see a friend post something on Facebook and they sort of hover over that report button for a second, and they're not really sure if they should take that step, if they should go through and click the button. So what would you say to people who, to people out there who just don't know what to do?
Right. Well, you could get access to that content on the Help Center, but also it would be to ask the question directly, like, are you feeling suicidal, or having thoughts of suicide? And if they are, to really step back and listen. So this is not a time to make recommendations or to have judgments about their experience or to say they shouldn't be feeling this way. This is really a time to be a friend that listens and it is non-judgmental. You acknowledge their emotions, you demonstrate real respect, you communicate their value as a human being on this planet, and you would try to empower them and yourselves in the process. And these are guidelines that Holly Hetherington at Facebook has kind of promoted and moved forward with. These are some of the best steps for how do we best interact with our customers and give them what they want.
Right. And Ursula, so what's the line between when you should report something to Facebook and when you need to take a more direct action? I mean, what do you do if it seems like there might be imminent danger?
So if there's imminent danger, if the person is saying, I'm about to kill myself, or you know them well enough that the post gives you pause, you get goosebumps, you know something's wrong, that's when it actually is time to call them right away, immediately, see if you can reach them. If it's very clear that they're about to harm themselves, then I would recommend reaching out to local law enforcement to do what's called a wellness check. And I know that there's controversy around that, and sometimes that isn't the most helpful thing. And at the same time, for many, many people, that has saved their lives in that moment. Not that the problem is over, not that that is solved things for forever, but getting through that moment, for some people, it has been helpful.
Yeah, clearly this is a very important tool and hopefully one that will help save lives. Ursula, thanks very much for being here.
Thanks, Sarah.